Hello, and welcome to a webinar on leveraging partnerships to support system change, where we'll be taking a look at how partnerships can be leveraged to successfully navigate the early stages of cross-sector collaboration, with a special focus on how this can help to support changes at the system level. My name is Melanie Sanderson, and I'm joined by my colleague Dr. Kim Bergeron, as well as Vincent Ning from the Thunder Bay District Health Unit, who will be presenting with me today. I'd like to take a moment to acknowledge the land on which we are working from and the traditional people of this land, the Anishinaabe, the Haudenosaunee, the Wendat, and the Mississaugas of New Credit First Nation. I would also like to acknowledge that one of our presenters is in the Robinson Superior Treaty Territory, and that the land on which they gather is the traditional territory of the Anishinaabe and the Métis. We recognize that Indigenous practices of health and well-being have been in place on this territory for thousands of years and are maintained to this day. We also recognize the special relationship that Indigenous and non-Indigenous people have affirmed through treaties signed at a nation-to-nation level. As settlers, we are grateful to have the opportunity to work on this land. For those of you who are joining us today and are new to OPHA, I'd like to share a brief mention of who we are. OPHA is a member-driven, nonpartisan charitable organization, and we focus on providing leadership around issues affecting the public's health and strengthening the impact of those who are active in public and community health throughout Ontario. This webinar is being brought to you as part of OPHA's Keeping Kids Healthy Through Collective Impact project, which is a project that focuses on improving the linkages between the health and social sectors in order to better address the social determinants of health. You can learn more about this project or find some of the project resources by visiting the website listed on the slide. I'd also like to take a moment to recognize our project partners who we are collaborating with, and particularly want to recognize the teams in Peterborough, Middlesex, Thunder Bay, and Ottawa who are leading their respective collectives in each of the 4 participating communities. As mentioned, Vincent is joining us from Thunder Bay District Health Unit today, and he as well as his colleagues have been very busy conducting situational assessments, creating and implementing action plans, and planning for evaluation, all while remaining committed to employing a collective impact approach to engage with local partners in the community. Partnership is such an important aspect of this work, and as so we are looking forward to hearing from Vincent with some of his examples from Thunder Bay in just a few minutes. In the live version of this webinar, we take a moment to find out who's joining us and how many people are participating in this webinar together. In the live version of this webinar, we also take a moment to find out what sector those who are joining us identify with. And so we've asked people joining on the line to complete the following poll. You should see the answers pop up in a moment. Taking a look at what we hope to cover today, our goal is to share with you some case studies, some examples of partnership across sectors, as well as some tools that we hope will be useful to you in your work. We'll talk a little bit about relationships and partnerships as a source of knowledge and skills, and we'll share some information on how the partnership effort can really position a group well for utilizing the collective impact approach. We'll talk about case studies and share a tool to do your own case study, as well as in the live portion of this webinar, open up a chat box so that we can reflect together on how this information might apply to various areas of practice. The idea of working in partnership or collaborating with other sectors has really been a key theme that we've continued to build on throughout this project. And so you may, if you joined us in our last webinar, remember that we featured a report that was shared around the learnings, challenges, and facilitators and strategies for working in partnership across sectors. These learnings were gleaned from the experiences of local project managers that were all working as part of the Healthy Kids Community Challenge throughout Ontario. And now in this webinar, we'll share some case studies and case study tools that came from that work as well. And the reason why we're really focused on ways to enhance partnership is because we have found that it's through these relationships that communities can start to create the conditions for collective impact work. And when we think about the system, and learning about those aspects of the system that might contribute to some children being disproportionately affected by the social determinants of health in a community, it becomes really important to include a diverse range of partners that can all offer different perspectives of that system. And so this work at the system level would then involve connecting with other sectors to try and work together in new ways to make changes happen. And as we've seen in this project, a lot of this work in the beginning really starts with building relationships with those in the community who are going to contribute to this mission. The collective impact approach is then a framework that can facilitate this collaboration around complex and persistent social issues. And so while we're not going to talk about the collective impact framework in this webinar, if you are interested in learning more about this specifically, I would encourage you to download our one-pager on collective impact from the project website, which offers some recommendations as well as some great resources to check out if you want to dig a little bit deeper or read more about this framework. But coming back to this idea of how partnerships can create opportunities for working with other sectors in the collective impact framework, I'd like to turn it over to Vincent from the Thunder Bay District Health Unit, who is planning to share some perspectives from his experience in playing a lead role in bringing partners together for a collective impact project in Thunder Bay.
Thank you, Melanie, for that introduction and for the privilege of being able to share our experience here. So as mentioned, my name is Vincent, and I'm a co-lead on this project with some of my colleagues at the Thunder Bay and District Health Unit. I wanted to start just by giving a little bit of background about Thunder Bay for some context. So Thunder Bay is located on the northwest shore of Lake Superior. That's about a 15-hour drive from Toronto if you're interested. And we have a population of about 105,000 people. Unfortunately, there's some pretty well documented health disparities and social disparities in the city. And we also have higher chronic disease rates than the provincial average. Some of the work that we've done previously has found that the greatest social determinants of health that play into our community is income and income disparities, food insecurity, housing challenges, and stigma. And those are areas that we've been doing a lot of work in. So when this project came out, we thought this is a really good fit for the collective impact model and for what the Keeping Kids Healthy project is about. So this webinar is really focused on building partnerships. So I'm going to focus on that aspect of this project. But if there's any questions about the action plan or the results of our work, I'd be happy to connect more after the webinar about it as well. So prior to the Keeping Kids Healthy project, we had a Healthy Kids Community Challenge in Thunder Bay, similar to a number of other communities across Ontario. And for that challenge, we had a steering committee that was formed. And the steering committee composed of different members like the school board and not-for-profits, as well as the city, who are invested in children's health. And the Healthy Kids Community Challenge really focused on a lot of the health behaviors like healthy eating and physical activity. And the members around our steering committee, I'd say, represented that. So they were people who would be able to promote those kind of behaviors. That said, even during the HKCC, the Healthy Kids Community Challenge, our committee had a pretty strong focus on trying to change some community level structures that related to the social determinants of health. And so we thought it'd be a really good natural transition into the Keeping Kids Healthy project. And many of the steering committee members were very committed to this idea. As you will recall, the Keeping Kids Healthy project has the goal of looking less at programs and services that are implemented and more at how do we change the structures and the systems that make people more vulnerable. So this change to a systems level shift ended up being a bit more significant than we had anticipated, especially as it relates to involving our partners. our partners at the table were really good at looking at, okay, what do we do together? How do we work well? Who do we connect with? And as we were thinking about how do we really make changes that can be long lasting, the idea of systems change came up, and particularly systems change around how networks are formed and policies that are developed. And we focused less on what we're doing together and more on how we work together. And that had some implications for the nature of those partnerships. And it raised a lot of questions like, okay, am I the right person to be at this table? What does it mean practically to work on systems change? Is that even in my mandate? How do I work on it? Is there someone else that should be involved in this project? So those were really good questions. And one thing that we learned is that when we have a shift in our kind of stated objective of meeting, even though this is something that we're excited and passionate and supportive of, when we made that official switch, it raised questions that went a bit deeper than we would have anticipated. So I'll get back to that point, but I'd like to start just by discussing how we had started off our work. So our first step was to conduct a situational assessment. And I'd say the greatest value in doing that was really the opportunity to involve our partners in discussing what are the things that matter to you. At the same time, we were pretty conscious of being action oriented in that engagement. We're well aware that people have survey fatigue, that many of our neighborhood residents and community members felt like they were being overstudied. They get asked all the time about what they think. And yet, um, often action doesn't follow from that. So that was something that we tried to keep in the forefront to really have that balance where we're spending less time just asking things for the sake of having this comprehensive view of what's happening, and more around questions that could lead to specific actions. And we also spent a fair bit of time trying not to reinvent the wheel. And this sounds rather obvious, but I'd say for those of us who work in the area and are used to doing needs assessments or situational assessments, I think sometimes we get in the rhythm of it. Like, okay, here's the data that I have to look at, here's the people to contact, etc. And we don't always do a deep dive into trying to synthesize what other people have found previously, at least in my experience. But doing that was invaluable. We were able to connect with some new partners that we wouldn't have otherwise connected with because there was a recent report that had gone out with another organization, the Wellesley Institute out of Toronto, and they had done some really good work here earlier. In addition, connecting with their work and some of their partners helped us to realize a need that we hadn't previously identified as strongly, which was the impact of stigma, particularly towards Indigenous people, and the disconnect between organizations and services that were Indigenous serving versus non-Indigenous serving, and some of the duplication that had happened there. So that was another learning lesson. Part of the collective impact process is developing a common agenda. Now, we thought that this would be rather straightforward. We were all coming together on children's health. There were some stated goals already with the Keeping Kids Healthy project, that is to support those who are most affected by the social determinants of health. So how hard can it be to come up with a common agenda? Well, turns out in our experience, it's actually fairly difficult. And I'd say it took us about 6 months to a year to really nail down. Our common agenda ended up being moving forward all kids healthy in our neighborhoods. And there were some additional points with that. But this kind of sense-making stage, as it's sometimes called, took a fair bit of time. And part of that is children's health is really broad. So if we say we want to improve children's health, how do we even conceptualize health? What are the indicators related to that? And could we realistically shift those indicators within the timeframes that we were looking at? And in addition, if we're trying to achieve that goal by making systems change, what does systems change look like? Tangibly speaking, how do you know if a system is changed? So those were some pretty big questions that came up. And one thing that I learned is that in developing a common agenda, it takes a fair bit of time. And that's a lot of time where people feel like I'm meeting and sure, this is good discussion, but I'm not really feeling like there's action coming from it yet. And at that point, I would say a number of our partners around the table were probably feeling that. And it was the previous relationships that we had formed with them through the Keeping Kids Healthy project, sorry, I mean the Healthy Kids Community Challenge, that allowed them to stay at the table and stay engaged because they knew there's a level of trust that we weren't just people who were interested in talking. We wanted that to lead to really improving the health of our children. So it was a pretty significant shift, and we had to think about things a little differently. Now, in that process, there were some changes to the partners that were on the table. There were some new partners that joined in, and there were also some partners that left the table. And I think that part of the experience was learning to be okay with that. The door is always open for those who want to join in. And I'll just make a quick note here that as a backbone support, I think having our organization to play that role was pretty key. And a part of what we did as a backbone support was to play this kind of relationship broker role. And we made a lot of phone calls, had some coffee times where we met up with people, kept them up to date. If people missed meetings, we would email them or call them just to fill them in for a few minutes. And those were all pieces I think that were really important to keeping people involved and engaged in the process. So I'd like to share a bit more about what is it like as the partnerships evolve and the relationships shift. And I'd just like to kind of give a quick overview of that experience. So I already mentioned that we are focused on systems change in this. And by nature of having a goal that's a bit abstract and a shift in our goal, at least our stated objective, that creates a little bit of discomfort and also shifts some of the dynamics around who's at the table. So we needed to form some new partnerships because this was a broader goal. And a part of how we had initially begun doing this was by doing a stakeholder wheel activity, and we figured out what are the different sectors where we have existing partners and what are the sectors where we need to have new partners. But admittedly, getting new people involved was quite challenging. And a part of that was because we were still at the same time developing our common agenda. So there were some challenges here. We didn't exactly have a very clear picture, at least in terms of an action plan of what we were asking people to join in on. And there was also some changes in the organizations in terms of staffing. And finally, it was challenging for people to conceptualize systems change and what that meant in terms of joining in this initiative or staying into this initiative. On the flip side, I would say some of the opportunities that we had were there were already existing relationships that could be leveraged. There was a level of trust that was formed as a result of that, and we're really active in engaging the committee members in that process of co-developing the common agenda, co-developing an action plan. In our early stages, we also had a third-party facilitator come in and guide some of that conversation, which was really helpful, I think, for getting people's minds around the idea of systems change. So if you're in an area where you're building new relationships or having a shift in a goal using some existing partnerships, and there's an opportunity to have a third party facilitator, I would highly recommend it. So here's a list of some of our local project partners, and I'm just putting this up here to give you an idea of some of the different people that are involved. So we have some local not-for-profits, some health organizations, some children serving organizations, and a number of other community-based groups. And as mentioned before, it's the trust that we had in those relationships that was really key to helping to move things forward. And even though it's been messy, there's been some really neat products that have come out of that. So, for example, we had a meeting a week or two ago, and at this meeting, we were talking about our evaluation of where we've come so far. And one of the members who is a tenant support worker in a vulnerable neighborhood said, "Oh, this has been so helpful because as a result of meeting at this table, I've been able to connect with person A and person B, and we've been able to run these programs for children, and that's been such a big need. I've been trying for the past year to make that connection and just haven't really had the opportunity, and this committee allowed me to do it." Then another person chimed in and they said, "Yeah, as you know, I don't often have a lot to contribute in terms of my program that I work in, but as a result of this table, I've been able to connect with a bunch of people who sit here and who do work in an area that really benefits my clients, and I've been able to refer them to their program. And not only that, but I've started talking offline with one of these other members, and we're co-developing a program that's going to be mutually supportive for both of our clients." So there's some really neat kind of systems level changes that are happening where by nature of strengthening the network, we've allowed opportunities to come out. And I think those are some of the stories that for me are the most exciting. What are some of the lessons I've learned in terms of developing partner relationships and building on previous partner relationships, but transitioning to broader goals? I think the first lesson is that partners evolve. And that's okay. There's a lot of time and energy needed to maintain relationships, and being able to discern when to try and hold on to a partner and when to let it go, I think has been a big learning lesson. Another learning lesson is that relationships tend to be between people and not organizations. And I don't mean that there aren't organizational relationships that can be established, but what I mean is that oftentimes, whenever there's a new contact, I have to assume that the relationship is starting again from ground zero, even though we've had work with that organization for a long time. And part of it is just because it takes that much time to develop the trust and the buy-in. And planning for the time needed to do that was really important. I've already mentioned how it's often a non-linear path. And sometimes that plays out by things like trying to create common agendas while also building new relationships at the same time and having those new relationships feed into the common agenda, but then still need to move along with an action plan while building new relationships so that people can feel like they're joining into something. And I think just recognizing that it's non-linear is helpful. Along those lines, I've noticed that one of the tensions we face is we want members who join in to be able to provide input and shape the direction of the work. That said, often when people are joining in, they want to know what direction people are already moving in. And so I found that it's helpful to have some basic structures in place, have some outlined goals that can be predetermined, which allow people to join into something while also leaving some of the details to be shaped with ongoing input by the committee members. There's points where I've been hesitant to provide that structure or predetermine some of those decisions, but I've realized that that's been helpful for um, allowing people to see what they're joining into. And finally, the greatest piece I would say and the greatest asset is trust. And the time that's needed to develop and continue to increase that trust is substantial. I spend a lot of my time calling people, filling them in on meetings when they haven't been able to make it, meeting up for coffee with people who are new into their roles. And I think it's well worth it. But that to me is one of the greatest lessons is just how important um, nurturing that trust is in being able to have people engaged in this process. So thank you. I'll pass it back to Melanie now.
Thank you, Vincent, for sharing your examples and insights from the work happening in the Thunder Bay community. As Vincent mentioned, an important step that occurred in this project was to engage with community partners to conduct a situational assessment that helped them to inform their common agenda that the groups arrived at. And so to support this, we've made some resources as part of this project, and we're sharing them for all to access. They can be downloaded at the project website, and you'll find one specifically around the situational assessment approach that we employed in this project work. Next, I'd like to turn it over to Kim, who will be taking us through a discussion on how we can learn more about partnerships through case studies, and I believe she will also walk us through a tool that you could use to apply to your own work.
As we have learned, all change starts with 2 or more people working together. And we heard from Vincent's presentation, systems change takes time. So how can you keep your partners engaged, develop relationships with new partners, or learn about what works well? The use of a case study design is one method to sustain and strengthen partnerships. Today we are sharing a resource we developed at the Ontario Public Health Association called A Tool to Develop Case Studies to Strengthen Cross-Sector Partnerships. This tool provides a process to focus on one initiative, program, or event that a cross-sector of partners work together to plan, implement, and evaluate. The aim is to provide a context to document the relationship between people working in different sectors and share lessons learned. It is about capitalizing on what was learned to support the belief that it is the sustainability of relationships, knowledge, and skills of those working together that can move communities towards systems changes that lead to population changes. The purpose of this tool is to write a case study that demonstrates the development of a cross-sector partnership. The aim is for those working together in these types of partnerships to share their experiences overcoming challenges to achieve successes together, and by doing so, everyone can consider these experiences to strengthen their own partnerships. You may be wondering, why should your partnership take the time and energy to write a case study? One reason is so your partnership can learn what worked well and what could be done differently. Your knowledge of how different sectors operate can increase, and this may lead to stronger relationships. For example, we learned from the provincial scan, sharing resources was ranked high as a facilitator. Using a case study design, we learned from a community partnership working with the nonprofit sector that leveraging relationships and sharing resources was a strategy they used. And from their experience, the partnership was able to build on the connections that nonprofits have created within the community, and this helped them secure in-kind contributions. The tool includes information about why use this tool, 6 steps for developing case studies, that includes questions to consider and a template to capture the information shared. The intention is for partnerships to work through the 6 steps. There are several ways to do so. One way is for the partnership to work as a group through each step. Another way is to have partners work individually through steps 3 and 4, compare their answers, and summarize the information in the template provided. Or a third way is to engage a third party to interview those involved, synthesize the answers, and share the results with the partnership. The use of this tool and the enclosed template is also a great way to engage students. If you have a practicum student, a project that could be developed is for them to use this tool, interview your partners, and to use the template to write up the case study. This is a great way for students to apply the knowledge they learn in school to a practical experience. The first step is to agree as a partnership to engage in the process of developing case studies. And you need to ensure everyone understands the value of sharing this information as a way to strengthen and leverage the development of cross-sector partnerships. Step 2 is about, as a partnership, identifying one specific initiative, program, or event that includes the involvement of more than one sector. This is the case that you're going to consider as you work through the rest of the steps. Step 3 involves briefly describing the case and the sectors involved. And step 4, for each sector involved in step 3, you need to complete the set of questions related to challenges, strategies, examples of actions, and lessons learned. The bulk of the time is spent on this step, as it is dependent on the number of sectors in which you're engaging engaging in the process and reflecting on their involvement. Step 5 is taking all the information gathered thus far And using the template that we've developed, it's a Word document that has text boxes where you can insert your information. The last step, part of step 5 is once you've inserted all the information, is to send it back to the partners involved to validate the information and get approval to publicly share what has been collected. Step 6 is that we encourage you to submit your completed case study to the Ontario Public Health Association, and we'll publish it on our website. This will allow you to share the information with your partnership as well as others that are interested in working with that sector. We have developed this tool by writing 4 case studies from 2 different partnerships. The cross-sector partnerships featured in the developed case studies shared ideas of how various communities have built bridges between health and the social service sectors in order to strengthen their ability to work together and promote health. So we encourage you to visit our website and click on the developed case study so you can learn more about how case studies are written, as well as if you're at all interested in working with the education sector, nonprofit sector, or the recreational sector. Our 4 developed case studies will help you do so. In the live webinar, we did a chat feature and facilitated discussion around the question of what ways could the participants engage or encourage their partners to develop case studies. I have shared here some of the answers that were shared within the webinar. So it was shared that one way to encourage and engage partners was to frame it as a way to secure funding. So to prepare for the next funding cycle or to seek other fundings. Another participant shared that it saves time later, and it provides an opportunity to learn from experiences. It also emphasizes the value of sharing your story. It can be used to attract new partners, as well as the case study could be used as a starting point for strategic planning, as well as a means to evaluate your partnership. Another suggestion was others can learn from building partnerships and learn about the collective impact process. And lastly, it is a way to ensure that there is time built into these partnerships, allowing for raising awareness regarding the tool and then taking the time to work on the case studies. So I encourage you, if you're listening to this recording, to jot down some ways that you could encourage your partners to develop case studies. The last thing I would like to share is related to reminding you to post your developed case studies. I also want to share one other idea that was shared during the webinar. It was related to engaging in this case study development by ensuring on your agenda with your partnership that the first 15 minutes is used to talk about the benefits of developing a case study and then actually using that time to develop the case studies. So in my own personal experience, what I have done with my partnerships is the first 15 minutes as an icebreaker, we actually worked on the case study. So it was a reflective time. So we worked through the questions and we used that information to build a case study. So I'd encourage you to consider that as a way of using this tool.
Thank you, Kim, and thank you to all those that participated in the discussion in our live version of this webinar. We're coming up to the end of our time together, but before we go, I just wanted to share the link once more of where you can go to download the resources that we talked about today, or where you can go to learn more about sharing your case studies with us if you would like to have your story featured alongside of cases we talked about. We'll also be posting the slides from this webinar to the website, and so if you have found this recording and you're listening to it now, please do feel free to share it with others who you think might be interested in this work. If you are curious about learning more about OPHA and some of the other initiatives that we have on the go, please do check us out at www.opha.on.ca. This concludes our webinar for today. We do hope that you enjoyed the presentation, and do feel free to get in touch with us if you have any questions or would like to learn more. On behalf of Kim, Vincent, and myself, and the rest of the project team, thank you for participating.